Lane, Director of Diagnostic Services at Northern Dutchess Hospital. So this is our checking area here. We have 2 lanes that come through. Cars will present. They're asked to keep their windows up. As they come through, they display their insurance information, their prescription, and their identification. All 3 are required. We take pictures using an iPad through the window of the car. That information is then sent up to our lab processing center, where it's matched up with the specimens as they get up to our area for processing. Then what happens is we put information for the specimen collection for the next phase of the testing, and then the vehicles follow these 2 lanes over to our collection tent, which is on the opposite side of the parking lot, where a team of professionals then do the swabbing and the collection of the specimen, and then they're finished, and then they get the results later from their physician.
Can you talk a little bit about what we did today, or what you all did today, and then how it's gone in other, because this you set up now, this is the third and fourth site for
Yes.
Newvan's system.
Yes.
Can you talk about capacity goals and stuff like that?
You want to talk about
Sure.
that?
So this is the 3rd site. The first 2 were in Connecticut. Our first day we saw 84 patients. We collected 84 samples. We had 79 appointments. So that's a big day for us.
Yeah.
Typically what we've seen on our first days were in the 50s and in the 20s. So this was a big day. We expect to double it tomorrow. That's typically what we've seen, and our schedule's already getting full for tomorrow. So, like Chris mentioned, it's really wonderful service to provide to the community. They're very happy to
Not
see
to
it.
hold anybody to numbers,
Yes.
but in terms of what you're seeing in other places at max capacity, what do we think what would be the goal here, even conservatively? So.
So Danbury's up to, I think, 254 patients a day. I don't see any reason why we won't see that many.
That's great.
Yeah, that's kind of what the infrastructure here is built for, is to hit that 250. So we can do 4 cars in here at one time, and then push the same out there to the queue. And the way that we set up the site is so it's not going to impact any of the traffic out
On the main roads.
Correct. So we can queue up several hundred cars within here with no impact to anything else outside of this site. And that's really what we were trying to, it's to be boring here.
Yeah.
That is honestly, overall goal is to help
I've
people
known.
and be boring.
Yeah.
And that's really what it was today. And that's what we saw as a success, honestly.
I think the important message here is that to be processed through this site, it's mandatory that you have a prescription from your physician.
Right.
Yes.
Unfortunately, we did have about 30 cars that showed up, people who wanted to be tested who did not have the appropriate paperwork to be processed and be tested. So as people come to seek this site, please see your primary care physician. Make sure that we get an order in the system, and we have ways to help the patients do that. And patients who show up without the prescription as they leave, we're giving them a packet on how they can move forward to get the information to be able to come back through the line.
But basically, the 2 things that you need are a prescription from a doctor and an appointment through the system that Newvance has set up. So to get the prescription from the doctor, assuming you have a primary care physician, call them. You don't need to go in person. You can call. They'll do a consult with you. They'll write the prescription, and then they'll give you the phone number to call to schedule through the Newvance system. We have a lot of people, though, in the county who don't have a physician or maybe don't have insurance or have questions. For them, they can call the Ulster County COVID-19 hotline, which is 845-443-8888. So that way, everybody can take one of those 2 paths. I mean, I really want to thank Newvance and their team. They have been, it was like 4 or 5 days ago that we said we want to do this. And this is incredible. So I always want to thank you all. And to give people a sense of what this does for our community, we have done a little less than 500 tests total in the last 2 weeks because we just haven't had tests and we haven't had a capacity like this. Now in 2 days, once we get up to capacity here, we can replicate that, which obviously will just be huge in terms of in terms of saving lives, because now we can better identify who is affected, we can isolate them, treat them, and that'll just keep every resident safer. So, I mean, thank you all.
Not everybody's getting tested. I mean, there's some criteria that's needed to fulfill
Yep.
to get tested. A lot of people are sick and they're saying, I should get tested.
Yep.
They told me not to get tested. What should they do?
So they should seek their primary care physician. Their primary care physician, they're going to still screen them what their signs and symptoms are. Do they have a cough? Do they have a fever? Do they have any other risk factors such as high-risk travel recently? So there's still a screening process that happens with the primary care physician. Depending on the results of that screen determines whether or not the physician feels that it's deemed necessary to send the patient on for COVID testing.
And then again, for those that aren't able to call their physician, at our COVID-19 hotline, we have our public health nurses, our county's public health nurses, that are available if needed to do that process as well, so that everybody can be served. I mean, this is not something that anybody should worry about paying for. That is all figured out. It's more about, with limited tests, we have to triage who has the most urgent need to get the test. Hopefully we get to a point where that's less and less the case, but right now that's the mode that we're in, given the limitations. So I do think it's important, the leverage that Nuvance brings to this, given the cross-river dynamic, because now we have a site here that serves probably both Ulster and Northern Dutchess and maybe elsewhere, and then there's the second site is down in
Dutchess
Stadium. At Dutchess Stadium. So even Ulster County residents who are in the southern part of the county could potentially go there. So that gives us a really good kind of ability to control any surges, right? Is that?
Some people from Northern Dutchess can come here.
Yeah, absolutely.
Absolutely.
And they are, I believe, right? Yeah. The county lines are, not honored by COVID-19 for sure. And so our response, we want to make sure is the same way.
No, I mean, this is really it. Once they're done, the specimens collected, then they're going to peel off out of here and then await the results from their primary care physician.
Could you speak about how this specimen is collected?
I'll let the medical.
I didn't see it.
Okay, I'm happy to. So they have a nursing staff that comes up to each and every car. There's a head nurse and then a helper. When the car drives up, the nurses take the information and the viral media that's on the car in the bag. They take that all out. They make sure that the patient's name and date of birth and other demographic information is correct. They validate that with the patient. The helper holds the viral media while the other nurse collects the sample, and it's a nasopharyngeal swab. They do the collection. They put the viral media, the swab back in the viral media, lock it up, put it in the correct biohazard bag, and send it away to the laboratory, put it to the side. And the patient then, it's as simple as them leaving. They have the packet from up front, so they know exactly what to do. If it's a positive, it instructs them to wait for their physician to give them a call. That's who will be giving them
How
the
long does it take for them to get that?
We're seeing about 3 to 5 days turnaround.